All right, hello everyone. So this evening we're going to demonstrate how to properly apply a 12-lead ECG or EKG. And so what we're going to do is don BSI, make sure our scene is safe. We have our BSI on, body substance isolation applied. Our scene is safe. We enter into the scene. We have our patient here on the couch. We are discussing with them. We introduce ourselves in our level certification. So, sir, my name is Alex Gato. I am an EMT student with Brook Academy, and I'm going to help you out today. And we have a chief complaint of, in this case, if it's a cardiac event, probably chest pain. And so we're going to do a diagnostic 12-lead EKG in order to ascertain what could potentially be going on with our patient and any potential interventions that we need to apply or have ALS apply based on the information we obtain. So let's go ahead and grab our electrodes. So here I've written the electrodes on little sticky notes. So we're going to apply them to our patient in the correct spot. Again, we're talking with our patient as we do this. We want them to let them know what's going on. Sir, we're going to obtain the necessary picture of your heart using our monitor, and we're just basically going to put some stickies on you. We're going to take some electrodes and place them on you in different parts of your body. So again, what we're going to do is we're going to apply the limb electrodes first. So our first 4 electrodes. So typically they kind of have a demarcation of right leg, left leg in certain sets that I've seen. So we're going to basically, again, when we have a patient in a supine position, in this case, we're going to ask the patient's permission to bare the chest. So I'm going to take your shirt off, sir, if that's okay with you. So we bare their chest. And it allows us to eventually apply the V1 through 6 leads. However, let's do these leads first, these limb leads. So we have right leg. Again, patient is supine, right leg. Typically, you don't want to put it on any major muscle mass, so I would try to avoid anything like the quadriceps or the biceps if I was putting the limb leads on. So we're going to put these on the ankle here. So you can't see, but that's on the ankle here. So we have the right leg. We have the left leg on the ankles. And that can extend all the way up and down the leg. But again, you don't want to put it on any major muscle group because that could throw off the reading. So, and then we have left arm and right arm. So we have his left arm here. We're going to put this anywhere between the shoulder all the way down the limb. Going to put the left arm there. And then we're going to put the right arm over here. So we have our right arm applied in the proper space, our left arm applied in the proper space, right leg, left leg, all avoiding major muscle groups that could potentially throw off the reading of this. So we have our limb leads applied. Now, obviously, I wouldn't let this gentleman's arm actually hang off like this. I would want them to be in a position of comfort, but also a position where they are supine and I have access to them. If this patient were wet for any reason, I would want to grab a towel and dry them off before applying these leads in the first place. I'd want to ensure that they are able to stick, and if they're in areas where they can make direct contact with the skin. If this gentleman happens to have a significant amount of hair in a certain area of the limb or the limbs where the limb leads are placed, I want to try to avoid that as well for accurate reading. So now we have V1 through V6 here. So what we're going to do now is gather V1 and 2. So we got V1 here. So we're going to find the 4th intercostal to the left of the sternum when you're facing the patient's sternum. So I would palpate the patient's chest. So sir, I got to just feel your chest for a moment. Find the 4th intercostal space. Place it to the left of the sternum, V1. V2 then goes adjacent, directly across the sternum to the opposite side of the chest, 4th intercostal space. We're going to skip V3 for the moment, placing V4 on again exposing the chest, on directly mid clavicular 5th intercostal space. So mid clavicular, fifth intercostal space for V4, and then V3, we're going to apply between V2 and V4. Then we're going to apply V5 horizontal with V4, and then V6. So that's anterior axillary for V5. So anterior axillary for V5, and then V6 is going to be mid axillary. So a little bit off camera here, but just on the side of the chest right there, about. So again, V1, fourth intercostal, directly across from it, V2, skip V3, go mid-clavicular, find the fifth intercostal space, apply V4, put V3 between V2 and V4, then V5, anterior axillary, and then mid-axillary for V6. So that's how you would apply all 10 of the leads to get your 12-lead EKG or ECG picture of the heart in order for diagnostic purposes.